We're on the road. Where transportation goes, community grows. Welcome to On the Road with the MTA. And welcome to another edition of On the Road with the MTA. I'm Jay Gibbons alongside with Stephanie Kay from the MTA. How's Stephanie over there?
Well, I'm doing great, thanks. I love the warm weather and the sunshine. It just warms you up. I just love it so much.
Isn't it so lovely?
And there's lots to do outside, too. And I'm so grateful to say this is the first time we're doing a live podcast.
Yep.
Usually it's re-recorded, but this is actually live. And our first guest to be live is in the studio, Stacy Doyle. Thank you for joining us.
Yay.
Oh my, it's nice to be here.
Yeah. Well, I must say, Stacy, I knew you from Zontas because are you the president of Zontas?
Yes, for the next 2 years.
Good for you. That's a big responsibility, isn't it?
It's fun. It's great.
It's a women's organization.
Yes.
And they do
empowers
so
women
much.
and does stuff for women and children, females, and nonprofits. Just a wonderful organization.
Well, I know I help out sometimes, and I love what you guys are doing, and it's just a long organization. How long has it been in effect there?
100 years.
Wow.
We
Stop
just
it, really?
celebrated 100 years.
That's a long
Oh my
time.
gosh! Yeah, you had a horse race, a fundraiser, and that was a lot of
Oh
fun.
my goodness, yes. And we're doing the same next year
I'll
because
be
it
there.
was such a hit. So
I won one of your rakes that were full of all these like little gift cards and stuff. I don't win stuff, and that was great.
everybody loves those
Yes.
gift baskets.
Yes. Oh, there was Karen. I know that Karen Church does a great job over there, and we have Mary Kramer and all you girls just do a fantastic job.
Thank you.
But that's not why you're here. That's just the other hat that
no,
you wear.
that's right.
Tell us why you're here today.
I am here to talk about the Genesee County Free Medical Clinic.
Now that is so valuable, Jay.
Absolutely.
Did you even know we had that here in
I
Genesee
did
County?
not know. We have so many cool things here. You just don't know until you don't know. Until you know.
Until you know.
Until you know. You don't know what you don't know until you know.
And that's why these podcasts are so valuable because we have so much going on. So tell us what they do. Is it truly a true free clinic?
It is truly a free clinic. So there is a prerequisite for being a patient of the free clinic, and that is you can't have health insurance. It's for the uninsured and underinsured. So we do help out with those that have insurance and just need help with their medications. So when we say underserved, it's to kind of fill that gap for those patients that have high copays for their medications.
Oh, yes.
So not only are we providing temporary health care, primary health care, we're also helping out with medications that are not controlled substances, but it's just a wonderful comprehensive clinic.
Well, I know we talked a little bit off the air because I know that there for a while you had to have insurance in order to get like your income tax returned. And I know Genesee Health Plan was wonderful. And Mike and I were let go from the radio station. We used Genesee Health Plan for a short time before I started working at MTA and had insurance through here. So you want them to have Genesee Health Plan, right?
Absolutely. Absolutely. We want every patient that comes in the door, first of all, to get care. Second, we want them to get continuity of care, and we want them to have some sort of a program or coverage. And GHP is a great partner with the free clinic. We actually encourage our patients. They have a time frame to meet with a Genesee Health Plan representative so that they can get that continuity of care, get empowered, and put their health care as a priority.
Which is so important. So anybody from Genesee County can come and see you. Any families, like men, women, children, anybody?
Well, we're specifically for 18 to 65.
Okay.
So most children have Medicaid.
Oh, sure.
If they don't have insurance in Genesee County. I love our Genesee County.
I know.
We're so great. We take care of so many great people. But so it's pretty much between 18 and 65.
Which is needed because after you're 65, then you have Medicare.
That's right.
That's helpful.
Exactly right.
I'm so glad you guys are there. I didn't even know. So where are you actually physically located? If somebody's listening, they think, I want to come down and I want to actually get some help.
That is a great question. We are at 2437 Welch Boulevard, and we're near the intersection of Ballinger and Welch, and we're off a side street, Dayton. So you're go into the parking lot right there at the corner. We got a nice strolling sign that was funded to us by the Mott Foundation.
Nice.
And so you can see us now, newly painted building, and we're across from MTA stop.
Oh, there you
It
go.
works out perfectly.
Well,
Yes.
I know you said you love that we partner with you because we give those rides to people who would not ordinarily get to something like needed like you have to offer if it wasn't for MTA.
Yeah, there were a lot of patients that wouldn't get to us if it wasn't for MTA.
Oh, I'm so glad to hear
and the
that.
United Way, of course.
Oh,
Yeah,
sure.
Both.
Doesn't it make you feel good, Jay, to know we work someplace so we can get people rides to something they desperately need, like
Absolutely.
healthcare?
Yep.
I know. We love
It's
our
so nice
jobs.
because it's so rare to find that anywhere.
I
The
know.
help you need when you need it.
Well, and I was told that Genesee County is one of the very few areas that give free rides for veterans. A lot of the United States don't carry that. We're one of the very few. I think the only one, actually, I was told.
That's what makes us so great.
I know.
I love being here, and I love being at the free clinic. There's so many great services that are provided there, and what people don't understand it's really free. So we have McLaren residents that come and see our patients along with an attending. So our patients see physicians. They get their medications before they leave. We have volunteer
Great.
pharmacists who are all a part of the Genesee County Pharmacy Association, and they'll come and give their time free. And then we
all
have nurses.
free?
Yes.
Wow. Oh, we should have known that when I had 2 little girls and was a single mom.
And,
That would have been great.
oh,
Because when you go through a divorce, the woman's never covered. The kids are usually covered through maybe the husband's insurance or whatever they have to keep the kids under there. But the woman's like, oh, well, you can do COBRA, and that's so expensive, or no coverage. It's like, really? And you got to take care of the kids and yourself and work. So I'm so glad to know that you're there for people.
oh my gosh. And I wish we would have been there for you too, because
Yeah.
we've had many families come in the same situation, and we're able to provide that temporary primary health care and get them on track and get them hooked up with a healthcare navigator and get some insurance and get some permanent coverage.
I know some people might be too proud or too embarrassed to say, I need help. But my gosh, your health is so important. Without your health, you can't do anything. They even teach you when you're on an airplane, when the oxygen masks come down, they say, get it on yourself first before you get on your child or your people you're trying to help. Otherwise, you can't help them if you're already, passed out or sick. So take care of yourself first.
That's a perfect analogy.
Yeah.
I should use that one
You
for
should.
our
You
patients
can use it.
because, yes.
It's
yes.
true.
And in fact, we have a 5K run coming up.
Yes, tell me more about that.
Yeah, and it's our one fundraiser a year. We're operated solely on the donations and grants and private funding. So we're not funded by any federal funds or at all. So this is purely donations. So this is our one fundraiser a year, and it raises a third of the money to operate the free clinic.
Well, that's
Wow.
important. Yes.
One event,
Yes.
1/3 of the money. That's a lot.
It's coming up on Saturday, May 18th at 8:30 in the morning at Mott Community College.
Yes.
That's this Saturday.
The Pearl Center. Yes,
The
it
Pearl
sure
Center.
is.
Yes. For those who are used to it being at the event center, we're going to be right next door. So not too far off the beaten path for next year for those that are used to coming
good.
every year. So.
Well, there'll be signs out there to direct you.
Oh, yeah, absolutely.
And so now, how much is it to do the walk or the run?
It's $30.
And you get a
that's cheap.
T-shirt with that too, don't you?
Yes, you get a T-shirt with
Good
that.
job.
And then those that have signed up for the CRIM training program,
Yes.
we take their CRIM vouchers too. So if you have a
Oh.
CRIM voucher, you bring that out and you get to walk or run in the race for free with that voucher.
Oh, that's
Very
Get
cool.
your shirt too.
That's really
Yes,
That's free as well if you have a voucher
yes.
then.
Yeah, we love the bling. Runners love the bling.
yeah.
And this year's special too, we have a lot of people who've dedicated, this is our 29th year doing the race.
Wow.
And they dedicate their time to the clinic and they dedicate their time to the race. But this year we are honoring the memories of Dr. Venkat Rao, who passed away this time last year. He was a pulmonologist that provided
heard about
yes.
What do you provide for? What do you?
Free consultation. So some of our patients are really sick when they come to the clinic, and so we have wonderful referral partners that will see our clinic patients for free.
Wow.
And Dr. Rao was one of those that gave back and would see some of our patients in need of that specialty service.
Oh, what a
So
shame!
we're
He
gonna-
was asset that was missed.
Yes,
That's
yes.
too bad. Well,
So-
that's a nice memory to do it. In
Yes, yep. And Peter Levine from the Genesee County Medical Society and the Health Coalition, we're going to honor his memory too. He passed away this last February, I think it was February, and he was a longtime member of the Genesee County Board of Directors of the Free Clinic.
Okay.
20 plus years, and a great advocate for health care and the clinic and the patients of Genesee County. So we're going to honor his memory as well.
Sounds like you use some new volunteer doctors.
Yes.
What if somebody does listen right now and think, you know what, I'd like to be, I'm a doctor or a physician or whatever they might do, that they can actually give a helping hand, or somebody who just wants to be a volunteer, maybe help with the Healing Hands run, walk, or even help you at the clinic? Do you need volunteers at the clinic as well?
All of the above.
Great.
That would be phenomenal. If somebody had even one day a month or bi-monthly or just a little bit of time, anytime, either for the race or to help at the clinic, we can always use volunteers. We're really short of RNs right now. So shout out there to any RNs who want to come and volunteer a couple days at the clinic a month. We'd love to have you.
Do RNs ever need to do like certain hours, like to get credits for something? Like they have to continue like an education? Could that count towards something like that if they had to?
It doesn't, but we have connections when they volunteer at the clinic where they can get CE credits.
That's what I'm looking for. That's what I mean.
Yes. So
perfect.
The David Hoff at the Genesee County Medical Society, he's having a CE event coming up too. So we could partner somebody up with that, and they could take advantage if they were a volunteer for us for that opportunity to get some continuing ed.
Is there a phone number they can call or get a hold of you or email?
Oh, I'm going to shout that out right now.
Please do.
That's 810-235-4211.
And that's for anything if they want to volunteer,
Anything.
if they have questions about wanting to come to the clinic, if they know of a doctor that might give some of their time or an RN.
Absolutely. Many hands make light work is what I say. Yes. And if everybody comes together, we can impact the lives of many. And in fact, one of our former patients is going to bring the ceremonial horn start because he's traveling back here from Kentucky. So he was a patient for about 6 months and wasn't working and had a lot of pain and just slowly but surely we're like, you can do this.
Yeah.
You can do this. So we kept on coming, and then we had a volunteer chiropractor. So
nice.
We lost our chiropractor though. So, another shout out, any chiropractor who wants to come in and give some chiropractic care, that would be great too. But he saw the chiropractor once a month, and now he has a job, great job, traveling all around being a professional painter. So he's going to come back and he's from the county, so he's going to start the ceremonial horn for the race. So
sounds like great connections that you're making too with the community and these very important people.
Yes, it's awesome. It just many people that love the clinic and have benefited from it or know somebody who has, and the partnerships are really what makes us shine. We couldn't do it without all of the community partners.
Absolutely.
Yes, there's so many. And we now have a food pantry, too.
Oh, you do? Nice.
Yes. I know food insecurities and the demand for food is great right now. And so if anybody listening out there, the Food Bank of Eastern Michigan is also a partner of ours. And anything you could do to help us or help them really ends up helping our patients. So all these connections come back around.
They do. I know MTA, even Ed Benning was in the car and he was delivering Meals on Wheels for people. And during the COVID, we had free rides and we gave water to individual homes and we took food to their homes. MTA did so much for that too. And MTA helps with the Food Bank of Eastern Michigan and with you, of course, like you said, and Genesee Health Plan. So I love working together. It's like you said, it takes a village. We're all partners like family to get people to get to where they need to go.
It does. And McLaren and their residents, they provide lab tests. We have RMI who provides x-rays for our patients. There are just oodles and oodles. And McLaren is our presenting sponsor along with the Zemer Foundation for the race coming up here. So
if somebody wants to do the race, is it too late the day of? Like, let's say listening and think, you know what, I want to do it. I want to get up this morning. I want to go for a run or go for a walk. Can they come the day of and sign up?
You betcha.
Good.
Yes.
Oh, good.
And furry pets, furry family members are welcome.
That's
Families,
nice.
Wagons, strollers, you name it. Even if you just want to come out and walk the walk, you can do that as long as you don't want to be timed in that. We just encourage participation.
Okay, so they don't have to do the whole sign up or anything. They just kind of walk along and have a good time if they wanted to.
Right.
So
but we do encourage them to sign up.
Well,
the benefits
please.
clinic.
Absolutely. Who wouldn't want to give to a great organization like that?
Mm-hmm.
So it's 29 years of Healing Hands with a 5K run and walk. Haven't you seen it grow over the years?
Oh my goodness. It was really big. We had right before COVID, it had hit that like 250 and
Wow.
300 mark of participation. But then COVID,
Sure,
we
changed
couldn't
a
have
lot.
it for a couple of years. So now we're building it back up. Last year, we hit over that 200 mark again.
Oh, good.
So we're hoping this year we can, creep back up to that 250. That would be outstanding.
Well, I checked the weather. It looks very good.
Oh, it looks
It looks like
good.
maybe a little bit of clouds, like possible rain, but it looks like the rest of the day is going to be beautiful and gorgeous.
No, it's going to be.
It's all going to be good, isn't it?
Yeah.
Well, we know it's not going to snow, so we're good.
That's true. Well, we do the Friends of Public Transportation do a golf outing once a year, and I can't tell you how many mornings the clouds were dark and rumbling and rolling. We thought, oh no. By the time the golf outing started, the whole shotgun start, it cleared up. It was sunny and beautiful. So even if it looks clouded that morning, I would definitely recommend still come out there and still line up because you never know.
Absolutely. And the runners say a little sprinkle never hurts either.
Cools you off.
So,
That's right.
we whatever the weather is, somebody will be happy.
Rain or
on
shine, it's
Saturday.
going to happen,
Yes,
right? No
yes,
matter
it
what.
is.
As long as it's not
It's
lightning
gonna
and thunder.
happen. That's right. That's right.
It's going to be good. It's going to be good. I can feel
Oh,
it.
it's going to be great. Yes, so many people. And then we've got lots of volunteers and students cheering the way. That's what we heard last year. Even if you want to come out and volunteer for the first time, sometimes that first 5K of the season, you want everybody out there going, you can do it. You can do
that
it.
helps
So,
too.
yes.
Just keep going. Get tired. Think, I'm slowing down. Then you hear that. Come on, just right there. It's like, okay, I can do it.
And it's a great symbol of our clinic,
Sure.
and all of the volunteers and what patients get when they come into the clinic is what the runners and walkers get when they're out there. They're just supported and cheered on, and you can do this.
Do you ever take like a great group picture of everybody when
Oh,
they're doing
yeah.
it? Oh yeah, I
Yeah,
want to put
oh,
that.
yeah.
I'll share that on Facebook with you.
Oh, I'd love it.
Yeah.
Yes, that
Do it
would be
just for sure.
great. Yeah.
Well,
yes.
I know how busy you are. You have so much on your plate that you're doing, and I don't want to keep up too much of your time. Is there anything else you wanted to talk about before we say goodbye to you? Is there something more you'd like to say?
Oh my goodness. Just
So much. Go ahead.
I just want to thank all of those supporters like you and just anything you can do to promote the walk and promote the free clinic, because it really is free. Our patients get so much comprehensive care for free. And next year's walk, just if you want to save the date, if it's
Sure.
too late and you can't come this year, next year's date is Saturday, May 17th. So mark
Good
your
to know.
calendar.
Okay, very good to know.
You heard it first here.
That's
you heard
right.
about next year's walk run.
That's right.
That's right.
Already.
As you're listening to this, please feel free to share this on your Facebook page. Share it anywhere you can to let people know what great services are out there. A free clinic, and the walk can make it a fun way to promote that.
That's right.
So for sure, thank you,
Thank
Stacy.
you so much for having me.
Absolutely.
This is
Well,
great.
success on that. And thank
Yep.
you,
Thank
Jay,
you.
for doing all this, because it's our first live episode, and we didn't make any boo-boos, did we?
No,
Don't
not that I
think
can
so.
think of. We can always add boo-boos if you want.
Nobody said a bad word or anything. We were good. And thank you for listening. Please listen every week as we bring you the wonderful things that are happening in our community. Free food, free items, free services, and anything that might benefit you and make life better. With On the Road with the MTA, Stephanie K. and Jay. Thanks for listening.
You've been listening to On the Road with the MTA. For more information on our services and community outreach, visit us online anytime at www.mtaflint.org. And be sure to follow us on Facebook, Twitter, and YouTube. The MTA, your community, your connection, your way.